Hello, and welcome to the Center for Emergency Medicine's training videos. Today, we will be seeing what a joint immobilization with sling and swath should look like according to the NREMT's guidelines. This will adequately prepare you for your National Registry Psychomotor exam at the end of your class. I'm going to consider my proper BSI and PPE. I do have my proper PPE on. I'm also going to direct my partner to hold manual stabilization of the patient's affected joint. I'm now going to assess for PMS in my patient's distal extremity. I do find a pulse. I'm also going to ask them to move their hand and if they can feel me touching their fingers. It appears that they can, so I'm going to now apply my splint using a sling and swath. Taking the point of the cravat, I'm going to tie a knot in it to create a cradle for my patient's elbow to sit in. I'm then going to place the cravat pointing externally, bringing the top of the cravat around the back of the patient's neck. And now having the patient bend their elbow and pulling the cravat over, again cradling the arm. Ensuring that I'm covering the whole forearm and then tying up at the shoulder. I'm now going to apply my swath around the patient so as to hold their arm against their torso. I will wrap my cravat around my patient's back. And tie it on the side. I have now applied my sling and swath, and I'm going to again check PMS in my patient's distal extremity. I do find a pulse, and I'm going to again ask them if they can feel me touching their hand, if they can move their hand for me. It appears that they can, and I have now properly applied my sling and swath to immobilize their joint. Thank you for watching, and please follow up with your instructor or class coordinator if you have any questions.